Hey guys, sorry that it took us a hot second to get the live stream going there. I decided to do the dumb thing and edit and record a video all in one day, even though it's a longer video, because somebody wants to hang out with me tomorrow, and I kind of found that out yesterday, so I decided to go rushing through my entire process and drive myself crazy and kill off my brain. So if I seem to lose track of the conversation a couple times, Jen and I literally lost track collectively of a sentence earlier. This is where we're at tonight.
So, what was it? See what I mean? Like, I'm like, fuck. Saturday night? I don't remember what woke me up, but I got 4 hours of sleep. So I fell asleep about 4. I got up about 8 on Sunday. And last night, we put up the tree last night. At every time I'm trying to, like, I'm starting to doze off.
Carpathia says you look gorgeous tonight.
Thank you, Carpathia. Every time I started dozing off, I could hear the cats. My bedroom's on the bottom floor by the living room, so I can hear the cats in the tree, and I'm hearing like ornaments and shit knock off, and I'm like, so there's another 4 hours, and I was like, yay, I'm gonna take a nap. Not with my kids' virtual schooling session. No, not on Mondays. So I'm fucking.
So with how
I didn't plan that. Legitimately, I didn't plan that.
Sure you didn't, Jen.
I didn't. Like, my body was like, oh, you want to talk about tired, bitch? Okay, let's get sleepy.
So, with how tired Jen is, and with kind of how much we've got to cover tonight, because Jen said that she didn't want to go more than an hour and a half, so we're going to really try to stay on target, despite the fact that our solo shows are somehow even worse than our guest shows as far as, like, fucking off into other tangents. I'm going to do my damnedest to be good tonight.
Sleep, y'all.
So, we should probably start off with what got me to want to do this, because even though Jen is kind of going to be the one doing most of the covering of Biden's policies regarding this, and we're going to have kind of a discussion at the end, I'm the one who was like, we're doing this next week, and got very insistent about it because some bullshit happened with my insurance, and I'm more than a little upset about it. So press F to pay respects for our monetization. By the way, this is going to be a policy conversation. If you guys want to get your question looked at ahead of the pack, as always, super chats are available, and all super chats will be read before other questions, but we will try to respond to everybody. Also, the person who submitted, Marie the Battle Envy, I think, who submitted the fan art from last week's bridge, your fan art is actually going to be featured on the Heracles video that's coming out on Thursday. So I'm sorry that I missed that during the show last week. It will be on the video to show it off. So, coming back to what happened. So those of you who have been following the channel for a while know that I'm extremely public with my ADHD diagnosis. It's something that I crack jokes about on the show. Jen and I talk about how we're twins because we both have it. And mine is severe enough that I need to take Adderall XR. And I'm really, really open about that. Yeah, Adderall XR, it's the lowest dose of Adderall XR, mind you, but I do have to take it. That's how bad it is. You've seen me on my bad days, so you know how bad it is.
You know what's funny? That's actually how I found out I had ADHD. Was
let me guess, you took an Adderall and it didn't get you high. It just like calmed you the fuck down.
So I was in college. I was in college and I was studying for finals. And my friend says, what the fuck is that noise? Holy shit, did World War III just break out across my house because like 8 fucking helicopters just rattled over?
So we have definitly lost our monetization.
Sorry.
It's like 4 F-bombs and a B.
Fuck? Okay.
5
like my
F-bombs.
boobs rattled and I'm like, what the fuck is going on?
You were about to tell me how you figured out you had ADHD.
Yeah, so I was like 22. I was young. 21 maybe. And I was studying for finals and I just couldn't focus. My friends are like, I was tired and shit. My friends are like, yo, try this. This shit'll keep you up all night. I was so fucking focused and then slept the best that I ever had that night. And I was like, fuck y'all talking about? How the fuck y'all staying up this late? I was like, I slept fucking great. And they're like, you should probably talk to your doctor.
Well, at least our obligatory trip to Memory Land happened at the beginning of the stream.
When I was like, I slept great. How the fuck did y'all stay up for 12 hours? They're like, You should probably talk to your doctor.
By the way, Jen, since you were actually spending time with your family on Thanksgiving, there is new sewer lore related to electrified rusty sporks that you need to be filled in on at the end of the show. And I know at least one person's going to reference it now that I brought it up.
That sounds like a bad prison tattoo gun.
Oh my God, of course you went there. So coming back to my ADHD medication because I'm going to finish this anecdote someday, I promise. We're on record time. We're 5 minutes in and we're kind of on topic. This is a good thing.
Ooh. Besides, the rattling boobs. I swear that shit, my tits fucking shook like a 2000 fucking Motorola pager. Like, the fuck? Is 143 written across them or some shit? The fuck?
Oh my God.
Oh, y'all too fucking young to know what I'm talking about. Never mind.
Jen, don't go there. Whether minors belong on my channel or not, we do have them in the audience.
Yeah.
And dear Susan might as well be 12
to know what I'm talking about with a 2000s I'm sorry, no, like a 1997 Motorola pager. It's like I said, a prison tattoo gun. That's so. Yeah.
Coming back to the anecdote, I have been on Adderall XR for over 2 years.
Yeah.
But here's something that most people don't know about this particular medication. There is a, for lack of a better way to put it, patented release mechanism in the pill because Adderall, the normal tablets, only last 6 hours. If you want it to last the full 12 hours, you have to have this kind of coating on one of the doses in the capsule that makes it so that your body can only break down it after about 5 to 7 hours, depending on your particular metabolism.
It's a way that it's an extended release tablet. That's what the XR stands for. It's a system where it doses. You don't get all the medication in your body at once and then it just wears off. It I don't want to say micro doses, but it regulate doses.
It's two doses. It's one dose that kicks in right away, and then there's another one with this coating on it. This is how it was explained to me by the pharmacist when I got sick the first time, and we're about to get into that. But the coating on the second dose prevents your body from absorbing it until after between 5 and 7 hours, depending on your metabolism and how effective your body is at breaking down shit.
Thing.
Yeah. So Adderall does excellent things for me. I actually got very sick when I was on Ritalin. I also ended up in the hospital once and nearly ended up in the hospital a second time because I have a slight deformity in my heart. I was born with it. One of my heart chambers is slightly smaller than the other three. Works fine most of the time, but I have to be really careful with aerobic exercise and stress.
Yeah.
And here's the thing. With generic medications, the only FDA requirement is that they have the same active ingredient, in this case, amphetamine salts. That's what Adderall is. That doesn't mean that anything else about it has to be the same.
Any of the fillers, right? Any of the coating.
Or the release mechanism.
Right, the release mechanism can be made up of different things. Any kind of the fillers, any kind of the preservatives don't have to be the same. The only thing that's required for it to be the same is that it's the same active medication and
in the same dose,
right? And this is why a lot of people don't do well with generics or don't do well with a brand name, and this is over the counter too. Over the counter meds, it's the same way. This is what
happened to me was I tried, there are 3 manufacturers for generic Adderall XR in this country. I tried all 3. 2 of them, again, one sent me to the hospital, the other one nearly sent me to the hospital, and the third one didn't work at all. But what happened consistently was either it would kick in all at once at the beginning and I would get heart palpitations, which is what sent me to the hospital because I nearly had a heart attack, or it would kick in all at once toward the middle of the day, or it would not kick in at all until the middle of the night, or sometimes it would kind of feel like it trickled through the day and then hit all at once later. It never was consistent.
It was never consistent, yeah.
And it actually got so bad that, at one point in the community, I started getting in trouble with people because my meds would just stop functioning halfway through the day because it had all kicked in at once and my body started to finally get used to it. And so, I would get into social problems with people in the community or on Discord servers or other things because, I would just be off the freaking wall. And again, you've talked to me on days that I've taken medication holidays, you know how bad it is. My ADHD is completely out of fucking control without my medication. There are some people that need it and I'm one of them and I'm not ashamed of that. So here's where this anecdote gets spicy. This is the reason I had to explain all of this. My husband works for a union company. we have some of the best insurance you can get in the fucking country. Like, for example, I go to specialists and I pay $30 copay, no co-insurance, no nothing. When I got freaking surgery, like when I got, like I'm trying to remember what specifically it was. It was a biopsy of my intestines because they were trying to confirm that I had celiacs. I paid $30 for that. Plus, like, I think 50 for the anesthetic because, like, the anesthesiologist was out of network, but because it was an in-network hospital, they covered it at 90%.
Oh, that's right.
So, like, my point is that I walked out of a $15,000 surgery, paid, like, $80. So this is the kind of insurance we've got. I paid $40 for brand name Adderall currently. Well, my husband's company decided to switch the prescription insurance provider without telling anybody. For the end of the year. So in January, I got a letter from the insurance provider telling me, oh, by the way, you're currently taking this brand name Adderall thing, but we don't actually cover that. It's not in the formulary. So we're not going to be covering it all.
But you can have the generic.
Yeah, the generic is on the formulary. And that's what I'm stressing out about because my doctor, because of the fact that I nearly was hospitalized twice, my psychiatrist has me flagged as medically
your doctor
necessary.
Possibly provide out medical records and medical proof to the insurance company to attempt them to get to cover
She's going to try, but she said that not to get my hopes up with this particular company because they're stubborn. We have 2 super chats. I wanted to finish that bit of the anecdote.
Yes.
Hyatt says, come for the topic, stay for the bunny trails. Thank you so much. And Ikeda Hakubi, thank you. And thank you for your generous butt. The book that you bought me on Thanksgiving freaking came today. I told you not to, but you did it anyway. So you're getting a thank you at the beginning of the video, whether you like it or not.
I'm going to put it out to your audience too, because I don't know if it was Ikeda. Somebody had asked about a wish list last episode. Amazon displays your city, so I'm not comfortable with that. So if any of you know of a wish list service that does not display any part of your address, please let me know. That would be great. Thank you.
Ikeda says, have fun tomorrow, Allie. You deserve it. Thank you so much, Ikeda. So when I started doing research on the drug price for brand name Adderall, because again, I literally medically need it or I will end up in the hospital again. And if we can't fight my insurance and win, then I might end up having to crowdfund a year's supply of my medication and put that money away because I literally cannot do my work here without it. Like, again, you've seen what happens when I'm off my meds. I am completely out of fucking control. I am ADHD personified as a human.
Sorry, guys. I'm like moving a lot. My skin, it suddenly got super fucking cold and it's snowing here. So my skin went from all the moisture in the world to dry as fuck, and it itches like crazy. So I'm just like.
Yeah, this right here, by the way, guys, is part of the reason why the American freaking insurance system is fucked. You should not be jealous that I'm paying $80 for a surgery.
Let me shock you guys a bit. Now, mind you, mine was completely covered because it was a pre-existing condition. About 2 years before I had my hysterectomy, my mother had a full hip replacement. Oxidium hip with a titanium fake bone thing, and they had to extend one of her legs 2 inches. I had a hysterectomy. Which one do you think was more expensive?
The hysterectomy.
By how much?
Probably at least $5,000 to $10,000.
$20,000.
Damn.
My hysterectomy was $74,500.
Welcome to the medical industry.
Having my premature kid as a C-section was 30 grand less than that.
Yeah. Mm-hmm. But coming back to my drug costs, I started doing research, and it turns out that the lowest I can get that monthly cost if the pre-authorization gets denied by my insurance, which my doctor said she's going to fight. Like, she absolutely is going to go to bat for me. She had to fight my previous insurance and won. She's going to try to fight, but she told me not to get my hopes up. It's going to be $232. That's with a coupon from the coupon website that you would go to for prescriptions.
Oh, that GoodRx thing?
Yep, GoodRx. Yeah. That's the lowest I can get it. Without that, it would be $286. I thought it was $256 to begin with, but that was the GoodRx base price. When I called my actual pharmacy and all of the local ones, it was upwards of $280 at all of them, including Costco and Walmart, which a lot of people told me to go look at. So
Costco's usually cheaper.
Which shows that, and this is where we're going to get into the topic for tonight, that shows that the pharmacy company is the one that's hiking those prices, not the, that's basically the actual company manufacturers doing that.
The insulin guy, Martin
Shkreli. Also known as the most punchable CEO in history.
Oh my God, he is like, if Reddit had a face, it would be his. Yeah.
And Fanorala, I'm not going to go too far off into this, but I will say going to a psychiatrist as an adult seeking treatment for something is a very different experience than being a kid seeking treatment, because your parents are going to be potentially, even if they're good parents, are going to be looking for a different thing in terms of like you and your behavior than you will as an adult, and you'll have less control over it.
Yeah, I was going to say, you don't have as much control over it as a child or even as a teenager than you do as an adult, like for a large part, because a lot of it is narcotics, a lot of it does deal with mental health and a developing brain. When you're a child or a teenager, a lot of your care goes through your parents. Your psychologist will discuss things with your parents, and at the end of the day,
some parents,
right? At the end of the day, it ultimately, the decision, and probably more of the more major medical issues are going through your parents, whereas an adult, this is now in your lap, and things that would have normally been told to your parents are now being told to you.
Well, and you're also trusted a lot more, especially if you have a good psychiatrist, because there are some that are shitty. But if you have a good psychiatrist, you're going to be listened to a lot more. Like when I started having problems with Ritalin, she knew right away, like she understood. She offered, a number of different medications. We decided to try Adderall because there were signs that I might have needed the extra dopamine and serotonin that Adderall can release to help me focus. And it turned out to be right. She put me on the lowest dose, and I haven't swapped off of 24 milligrams since. But this is where we come back to why I brought up this anecdote. This is why this is important, because if the manufacturer can charge that much, we've got a freaking problem. And that's where we come to one of the major arguments for universal health care. The fact that a government, if they are a single insurance provider, can bully these drug manufacturers into much fairer prices, even accounting for things like the development costs and such, which are significantly overinflated quite frequently. Let's be honest, they have tax wizards that are going to overinflate everything. And as long as there's a profit motive for those companies, and also a wide swath of different insurers that could pay different prices, you're going to get stuff like $280 charging for even those of us who absolutely need it, because our insurance won't freaking call it.
Hold on. So, I'm listening. I'm double checking a point that I'm going to be making later.
So as far as this goes, though, there's been a significant amount of resistance to the idea of universal health care, at least on the outset, from the Biden administration. When I first mentioned that we were going to be talking about Biden's healthcare plan in our Discord server, the first thing that I got from several of the fans was, well, he said he'd veto any bill with universal healthcare. And your response was, I know exactly what was going on with that.
Right, I know exactly what was going on with that.
So I figured that's going to be a good segue into, Jen, go ahead and take it from here. Let's talk a little bit about what that comment was all about.
Right. So Biden has stated before that he's for a public option. What that is basically... Oh, we have a...
That's a question. Yes. Didn't we, the taxpayers, subsidize all that research the companies say they need monstrous profit for? Some things, yes. Other things, no. It depends on the condition that you're treating.
Yeah, it depends. Some conditions do get government funding. Some don't. And if the condition is being granted government research money, then yes, the taxpayers are paying that one. But if it doesn't fall under the government grant guidelines, then no, we are not. So it all depends on...
It depends on what condition and whether or not it's been researched.
What drug, what, all that shit.
Let's not even go into off-label use stuff either, because that's a whole can of worms.
Yeah, and fucking Depakote. We're going to try to give you Depakote for bipolar disorder. It's like a fucking same thing with the
Let's give you antidepressants to get you to quit smoking.
Yeah, they did that with Wellbutrin for me. Not only did it not get me to quit smoking, but it did absolutely nothing for my depression. I was like,
Okay, let's
Why am I
face it
bothering?
though. Let's not dog too hard on medication. Let me give a caveat.
Yeah, that's just for me.
Yeah,
Yeah, that's
antidepressants are medication roulette. They affect everybody differently. My husband is on a completely different medication than my other partner,
like, yeah,
and
I know a lot of people that did really well on Wellbutrin. I'm not one of them.
yeah.
It
So
does nothing.
this is not us shitting on mental health medications at all. Medication roulette is not fun, and medication roulette's how I found out that I needed Adderall over Ritalin, for example. So it's
Yeah,
important to go
it's
through the
yeah because you have to
process.
realize that everybody's chemistry is different too,
I'm so
and
sorry, Alien.
oh, like, but that's the thing. Everybody's chemistry is different, and like, yes, we all may be diagnosed with depression. We all may be diagnosed with bipolar disorder or ADHD, but the chemicals that we need are produced differently in everybody's body. So
Well, we
not
all
every
have different
medication is going to work.
metabolisms. We
Right.
all have.
Not every medication is going to work for everybody. But
So you like we're about to explain though
right.
about the spicy hot take that Biden had, and
So
I'm going to
yeah,
reject anything with
Joe
universal health
Biden
care.
has stated that he's for a public option. What is a public option? A public option means that he wants to expand government funded care. However, it will not be mandatory to enroll. You have the option of either choosing the private option or purchasing private insurance. That's where he falls on it. He is against any bill that forces anyone to all be on universal care. He wants there to be a choice.
Which, like, let's face it, if there's a quote unquote choice, that just weakens the public option in the long run, even if it might be the best way to get it.
Right.
Because that's what we're starting to see with the NHS. For any of my British viewers, I'm probably going to get a cavalcade of this in the comments, but one of the things that I've heard over and over is that there is tiers of healthcare still in the UK because the NHS is getting gutted because rich people don't have to care about the NHS because they have private options.
Right. And they do have some regulation on private insurance, but not nearly enough. Also with the NHS, while things like pregnancy are covered, you get better options of care if you purchase a private insurance rider. You get more selection of private doctors. You get a little bit more. Some specialists are private only.
Which, again, when you start to, like, that's where I talk about that weakens the public option. As much as people think that it's really successful. Now,
mind you, though, I haven't lived in England in 20 years. So it may be different now, but
from what I've heard from my British friends and viewers, it's only gotten worse. Like the Conservative Party's been using the private option as an excuse to keep weakening the public one. So things are getting worse.
It's when you see, and I'm very on the fence about this because I do believe I'm very much choice about everything. I believe that if you don't want medical insurance, fine. But if you do, the option for a universal care should be there for you. I don't believe in forced enrollment. I don't believe in forced anything, minus like public health options, like public health risks. Excuse me.
Apparently, we've got a viewer from Germany who is having a similar experience with the NHS.
Mm-hmm. Well, this is Germany, so it's different. It's called something different.
Well, that's why I said similar experience for the NHS.
Mm-hmm. The only time I'm for a forced option is if it becomes a public health hazard, like vaccines. I don't think preventative care is a public health hazard. Personally.
Well, I think that being forced to enroll to an insurance, like being auto-enrolled to an insurance, for example, or forced voter registration is quite the same as requiring preventative care on every citizen. I think that, like, it can function similar, like a single-payer public option.
I think there should be an option for the government to provide basic preventative care for every citizen who wants it.
Yeah, and I think
I feel about that.
Well, and I personally think that it should be a single-payer option ultimately, and we can talk about Biden's current plan in a minute, because that's what this video is supposed to be about. I think that single-payer, as in no private anything, is probably going to be the best route, but at the same time, like, that doesn't necessarily mean that there now needs to be HIPAA-violating stuff on the part of the government.
The problem is that we don't have regulatory control over other parts of our budget, and we don't have a set plan to regulate other areas of our budget. So provided, and here's the thing. God, this is so fucking complicated.
If even a fraction of what's currently being paid for in private insurance, though, goes into that, like especially if they have
right, but that's the thing. We can't sit here and tell the private insurance companies to turn over money to fund a public option. They're private companies. You can't.
No, but by creating a single payer system, like ultimately they wouldn't exist.
So yeah, okay. So for one, our government funded care is not funded by the federal government. Our government funded care is funded by each state. And each state gets a certain amount of budget per year for their Medicaid option. Medicare. Medicaid is for older people.
No, Medicare is for older people. Medicaid is the poor people because Dana is on Medicaid. My border is on Medicare.
Easy way to figure this out. Tennessee has TennCare instead of Medicare. That's how I always remember it. It's TennCare, Medicare. You know what? Let's Google it. Hold on.
Google says you're wrong. Google says Medicare is for old people.
Well, Tennessee's all fucked up then, aren't they?
Yep, Medicare is for old people because it says Medicare Part D, Medicare enrollment.
Yeah, okay, so that's wow. Why is Tennessee fucking me up? God damn it!
And the reason that I remember it is because Obamacare created a Medicaid expansion, which is the expansion for poor people. So Medicare is for old people. Medicaid is funded by the states.
Thank you for correcting me on that. Yes. So Medicare is the one that you pay into for with your taxes through a federal option. Medicaid, I'm going to fuck this up, is done by the states. And what everyone is thinking about when it comes down to government funded care is they're thinking about their state care system. Now, what we would have to do in order to, Medicare is an insurance program. Thank you. What we would have to do is find a way to transition that money that goes to the states and take the state's budget that they each lay out for their own state per year. Every state has a budget. They say, okay, this chunk is going towards state healthcare. And then they get a chunk of a federal budget. And then they decide where they're going to split up that federal budget between schools, care, roads, all that other shit. So they have to find a way to figure out how to get all these state taxes transferred over to the federal system in order to cover the cost per year per state, and then change the system over from state run to federal run. So this isn't something that somebody could just sign a fucking bill and it's done.
Well, and I'm not even pretending that it's anywhere close to that. I'm talking about in the long run.
But this is what people tend to think when somebody threatens using an executive order for a universal care option. This can't happen overnight. There has to be right.
This is kind of like the rant that I went on Twitter earlier today. I don't know if you saw it, but somebody was talking about, like, if you are a landlord and you charge any more than, like, the difference in your bills, then you're exploiting people, period. And I'm like, wait a minute. I'm getting taxed on that even though it's only the difference in my bills. Like, I have a friend who's living with me for that. And also there's maintenance cost and all these other things. Like, I'm not saying that landlords are not exploitative, but what I am saying is the current system doesn't allow a lot of the things that they were talking about the post, like partial ownership of the home or anything else. Like, I'd have to pay thousands of dollars for zoning in order to do that.
But that's step one, is that we have to figure out other aspects of our budget to not sink the country further into debt. Because now I'm for universal health care, but it is a massive undertaking financially. This is a massive undertaking financially. So we have two options. We can go the Scandinavian route where we tax people between 60 and 80%, but cover everything, which Americans are not going to fucking be happy about that shit. Or we wind up coming up with a plan to turn over the state's portions of the budget for their state care to a federal fund, which are going to get a lot of pushback from the southern states. So I can understand why they don't want to just turn around and say, no, we're starting universal now. I understand why they can't say that at this point, because that will literally lead into a revolt from many conservative states.
Ikeda Hakubi says, it's almost like you both are saying we should tear down this whole system and start over. Yeah, that's one thing that we do agree on, even if we both slightly disagree on which system should be rebuilt.
I think what we need to do is I'm for the public option. I am for the public option. However, it is not going to go anywhere without some severe reform and severe monopoly impositions, severe price gouging impositions, severe caps towards insurance companies when it comes to things like specialists, when it comes to things like prescriptions, when it comes to things like anesthesiologists.
Well, if we have a public and private, here's another thing I know you and I agree on. If we have a public option, if we somehow manage to find a way, like, let's, get into Magic Land for a minute, we figure out a way to requisition all of the Medicaid and Medicare funds and create a single public option that everybody is enrolled in unless they choose to opt out. Like, let's do that. We're going to have some kind of regulation against the private sector. Otherwise, ultimately, we're going to end up with an NHS type tiered care situation all over again.
Exactly. I can't. God damn it! This is a worst night for weird names.
Star Raptor Flock.
Thank you, because my mouth just went nope. That's what we do now. Each state handles its own Medicaid, Medicare.
Medicare is federal, Medicaid is state.
I'll figure this shit out one day. From the time I was like 20, I still can't figure this out.
Here's how I remember it. We care for the elderly, we aid the poor.
Thank you. That really works. That's what we do now. It's all handled on a state level. And this is where you have a problem. Where you get to the southern states that have a lower cost of living, that people are paying less taxes, they have less available in funds for care. And therefore, they cannot extend their state-funded program as far as, say, California or New York can. Because they're paying higher taxes there, and they're paying higher taxes back to the state to put back more into the state budget. This is where this is the problem that we're having now. And then you run into situations where you have states like Tennessee, where you have states like Nevada, that are begging the federal government for grants to cover more in their care system, but have to adopt things like Common Core or another government regulation in order to receive these funds. This is the problem that we're having now. There is state-funded care out there. My son is covered by one. But
one of my partners is covered by one because we can't legally cover him under our insurance because there's no federal recognition of polyamory.
Right. Now, you pay a higher cost of living, you pay higher taxes there than I do here. You are going to have more available to your care.
Actually. It depends on what you mean by taxes.
Well, we don't
have an income. We don't have an income tax.
We don't have an income tax, but state tax, sales tax, stuff like that. Not state tax, property tax.
Our sales tax and property taxes are roughly equivalent.
We're paying...
Because it depends on which county you live in here. There are some counties where you pay, like, absolutely your entire life in property taxes. The only reason I might pay more property taxes than you is because I'm currently living in a property tax bubble because there's a bunch of Asian companies buying up all the local
property
real estate.
Taxes here are no more than $1,000, $2,000 a year. It's extremely low.
That's fairly close to what we're at, but our sales taxes are out of control.
I want to say we're paying 9%.
We're at like 9.9, or I think we actually get 10
we're roughly about the same. But
by the way, that is that's an unfair tax on the poor. Fuck freaking sales tax only. Like, screw that system. You know what
gets me about fucking sales tax? And I learned this when I was living in Europe. Why can't they put the sales tax price on the fucking price tag in the goddamn store? Like, $199 turns out to $218 in
well,
tax.
the thing is they're actually not supposed to be passing that on to us technically. They just do because the businesses don't feel like paying it.
That's so stupid. But what I'm saying is, like, you look at something on the shelf, right? And it says $199. Now, in some places, it'll come out to like $218 after tax, right? So why don't you just put $218 on the tag on the shelf instead of $199?
Because $199 looks cheaper.
But it's different in Europe. And it doesn't affect the buying power, like, at all. Anyway. Yeah, that's the problem that we have now is, or states like Mississippi who have a and it's also the fact that the lower cost of living means they're going to get paid less. So they're paying less into, some people have income tax, some counties have a county tax, wheel taxes.
Income taxes make far more sense because sales taxes transfer an undue amount of tax burden onto the poor.
I'm in Tennessee.
You and I both pay a way bigger percentage of our income to sales taxes than Bill Gates ever will.
Right. So in Tennessee, we don't have an income tax, but Kentucky does. And I live right along the border. And I prefer to shop in Kentucky because the sales tax is way lower. It's like 6%. And I'm like, I would rather have income tax than be taxed on high sales tax and phone tax and this tax and that tax and wheel tax. I swear to God, I think we have a fucking breathing tax here. When you don't pay income tax, you pay taxes on everything else.
We have utility taxes here, which is sad because our utilities are like state run. So like we have taxes on our tax funded stuff. But anyway, this has to pay my electric bill tomorrow, so I'll let you know. This has to do with what we're talking about, though, because when you're talking about where's the money going to come from, if it's still in state hands, where's the money going to come from? Every single one of your pores.
This is where it's coming from the states. Yeah, every fucking time you go to Walmart, that's where your fucking state funds are going from. So
every one of your pores, all of your sweat glands, and maybe a few of your hair glands as well.
Another thing that we need to consider, a large part of the extremely high prices when it comes from insurance companies or when it comes from what doctors charge is to cover tort lawsuits, just in case. Tort lawsuits can cost hundreds and hundreds of thousands of dollars to just be tried, even if the doctor is not found at fault. For those who don't know, tort lawsuits are negligence, liability, wrongful death lawsuits. You can pretty much get a doctor in court for anything. You can sue them for anything.
We will do an episode on the pink tax in the future. Jen and I have promised each other, when we talked about transitioning the show to being political, it was one of the first things we talked about doing. We just want to wait until the holiday seasons are over before we get that mad.
So, case in point, my mother had an ingrown toenail many years ago. I think it was when she was still living in New York. Excuse me. And this fucking asshat doctor cuts the toenail out without anesthesia. And I'm hearing her scream in the back room. And I'm like, what the fuck? She's like, he didn't fucking inject anything into my toe. So she's talking to one of her friends who was a lawyer, and they're like, oh, you can sue for that. That's emotional distress. For a 5-minute thing. You can literally drag a doctor through court for 2 years and hundreds of thousands of dollars.
Unless your doctor forces you to sign arbitration clauses, which the majority of them around here
will not do. So that's another large part of it is we need tort reform laws. We need tort reform laws because a large part of the insurance companies, the drug companies, the doctors, the anesthesiologists, the specialists, a lot of their costs are coming to protection funds in case they get dragged to court on a tort lawsuit. I have watched people sue the hospital here for literally turning the floor is wet sign sideways. And they said they couldn't read it and slipped.
I honestly should have sued the doctor that refused to treat my freaking, my celiacs because he wanted to pressure me into weight loss surgery.
But that's legitimate. That's legitimate.
I ended up with thousands of dollars worth of bills that I think every single god that exists, my insurance ended up covering because there was a chance they wouldn't have.
So here's a little secret. You know a big part of the reason why the military is able to provide universal care? Because the military and their families cannot sue the doctors. They can't sue the doctors. They can't sue the hospitals. They can't sue the pharmacists. They can't sue any of them.
This is very much the sentiment of the chat tonight.
Mm-hmm. They cannot sue any of them. So a big part of that also would have to be tort reform laws. Because think about it. Say we do flip into a complete universal model. Do you think that we're not going to get taxed in order to cover these lawsuits? Countries like, okay, so Bragwin, I'm not talking about the VA. I'm Yeah.
Do you have any commentary on that? Because let's
I'm
face
gonna
it, like legal shit's like a tightrope. It is the thinnest
I'm
tightrope
going
you'll
to
ever
touch
walk
on that, but
on.
I do want to touch on Braegwyn because this is something that a lot of people get confused.
There's a
I'm
difference
not
between the VA and like active
Yes,
military
there's a
healthcare.
difference between VA and TRICARE. TRICARE is the active military health insurance.
There's a military brat.
VA comes from a different budget than TRICARE does. VA is
And
considered
TRICARE is far less likely to get cut than the VA.
right. Also, TRICARE has two different kinds. You can have TRICARE Prime, which is completely universal, which severely limits the doctors you can see, severely limits the specialists you can see. You can only see mainly
But you don't pay anything?
You don't pay anything, but they've kind of loosened it a little bit. If you live within a certain amount of miles from a military base, you have to be seen on that military base. If you don't, then you can only be seen through TRICARE Prime approved providers. TRICARE Standard is where you don't have to pay monthly for it, but you do have to pay co-pays. You have to pay prescription covered, half like your prescription cost, stuff like that. And that's when you have a little bit more freedom. To where VA healthcare is, here's a center, go. VA and TRICARE are two very different things.
So before we start getting into Biden, because we're at the halfway mark for the max length of the show, and you said you wanted to talk about Biden's stuff tonight. You did all that research.
I do want to.
I want to touch on Victoria's. I wanted to touch on Victoria's comment as well, because the comment here about the 3 strikes thing. As somebody who was going to go into medical stuff,
let me roll into this real quick. Aether. Yes, tort reform tends to torpedo the legitimate cases too. I'm not saying do the Rand Paul tort reform where you can't sue them for anything. No, I'm not talking about that kind of shit. But I do think that we do need something within the courts and some kind of qualifier for fluff cases for people who are obviously just trying to game the system. Victoria.
That's extremely dangerous. And this is coming from somebody who majored in the health sciences. For lack of a better way to put it, depending on your symptoms and your particular body and your genetics, you show up at a doctor for the first time, especially if you don't have any medical history or you have very little. Like, for example, I had no medical records whatsoever coming into being an adult because my parents are horrible. Even though I knew a lot of my problems, they still had to retest me for a lot of things in order to kind of save their own butts. Let's take my celiac, for example. If that doctor hadn't been a prat, the second doctor had to run a battery of tests to narrow down from all of the most common things to get to celiacs. Because celiac isn't very common. They're not going to snap their fingers and get it right the first time. Like, what do you mean by screwing up or not doing your job well? Because that definition is so subjective that something like that is messy.
Here's something that's very common in Tennessee. We have a very, very high opioid addiction problem here. There are many, many people who a doctor will know when somebody's pill shopping and refuse to write a prescription. Now, the reason why we have such a high problem here is that people come in with legitimate ailments. People come in with legitimate injuries, legitimate ailments. And the very, very first thing that they have been given is opioid pain medication, Lortab, morphine, shit like that. This now creates a dependency. So somebody can walk in, this doctor knows that they're pill shopping. They just, they have this hunch. This person's pill shopping and refuse to write this medication. They could write a non-narcotic or just refuse to give the patient medication, period. This patient can now walk into a courtroom, walk into a lawyer's office, walk into a courtroom and say, here's my medical history. This doctor refused to treat me, and sue them.
Well, and again, I'm not trying to trash on you.
But when you have states that have literally in a year distributed enough opioid pain meds to give every man, woman, and child in the state 2.5 pills, 3 strikes runs out very quickly.
Well, and part of the reason, I'm not trying to shame you, Victoria, but part of the reason that I bring this up is because, it's very difficult to tell if somebody's pill shopping. Like, getting ADHD treatment is extraordinarily, difficult because there are so many people that will take it and sell it versus people like me where I literally cannot function without it. My doctor knows that because I was hesitant to get on pills in the first place, and I was hesitant about even getting the ADHD diagnosis. But like, there could be a person down the street who's showing up, has a kid diagnosis, but doesn't need the meds and is selling their pills, and there's no way to tell the difference.
Victoria, they lose their license if they're found guilty.
Yeah.
They lose their license if they're found guilty. If they're found actually negligent, they are either put on depending on the severity of negligence, they will either lose their license or be suspended from anywhere between 1 to 10 years. Do make people pay legal fees if their cases thrown out? That's what happens. They're found to have to cover their own legal fees. However, they don't have to pay them. They can just have it be put on their credit report. File bankruptcy, get brought to court for a settlement. They don't have to pay them.
So now that we've kind of transitioned off into here's all the trouble with the system currently, we've talked about why the whole system's a problem. We've talked a little bit about why just immediate transitioning might have been terrible. The reason. Yeah, it might have been the reason why he said that.
We don't know if we have the job spots open. Healthcare is probably the most successful job employer of the United States, whether it be doctors, whether it be nurses, medical coders, receptionists, transcriptionists. The medical field is probably...
There's an entire industry of just people who manage all the different insurance companies and negotiate with them. Like, there's spots at every hospital for people to negotiate with insurance companies every year.
Right. Patient advocacy, there's so it's such a gigantic industry of employment.
And a lot of that would still be preserved under a single payer system, but a lot of the negotiating positions, everything that has to do with all the individual insurers,
would be gone. And you already have people who are government employed within the healthcare industry. So
you need a lot more under a single
but like system, we don't know exactly how many of those jobs we can fill, and now we have to find the money from the government to pay these new positions. So that's another big thing. Is I know that Biden's in a tough spot, and I really do feel for him. He's coming in on a downturn economy where we've been struck by a pandemic. Many people have lost their jobs. They're running out of unemployment.
And let's face it, our previous, glorious leader decided to start a trade war, and that's not fucking helping.
Decided to start a trade war. So and which led to hundreds of thousands of people in the manufacturing sector getting laid off. I can understand his hesitance to do anything that would mass lay off an industry of people. Because if he does that, if he does something that lays off hundreds of thousands of people in something as massive as healthcare,
the Republicans will never let the Democratic Party live it down.
It's not just that. Our fucking entire economy will collapse. Our entire economy will collapse. If we woke up tomorrow and said, we have a universal system from this point on, and everybody in private insurance in the United States, because private insurance is such a fucking conglomerate, is such a fucking power player in the United States. If we turn around and woke up tomorrow and said that universal care is the standard and private insurance is no longer valid, the sheer job loss, the sheer amount of unemployment that we would have to put out for, and the sheer amount of money being taken out of our economy would collapse our system. It would completely collapse. So,
Mithril, we're talking about a transition from the current system into a different one. Whatever ended up being the Medicaid replacement, Americare, let's call it for a second, that would be the largest employer in the U.S. just because the sheer scope and size. That does not mean that it would replace every single one of the jobs that would be lost from all the private insurers and all the positions from the negotiators and stuff.
We're talking
about a transition specifically. We're not talking about, neither of us thinks that universal care is bad. We both just think that the transition is going to be difficult.
No, I've been a proponent of it for a very long time. And I also think that the transition should have started 20 years ago.
It should have started 50 years ago. Like, there was a workers' Bill of Rights that was proposed back in the booming, ages.
It should have started 50 years ago so that when we are at a point now where we are in a pandemic, we're not sitting here discussing hospitals being at max capacity or medications not being able to be covered or people being too afraid to go to a doctor if they think they're positive for COVID because of the charge.
So
This should have happened 50 years ago.
I'm also going to remind everybody too. Y'all are so afraid of the government deciding what medications you're allowed to take. The government already decides what medications you're allowed to take. It's called the FDA. They don't even get approved unless the government says yes.
Hold on, I'm going to tell y'all a story. Hold on.
And when we're done with that, I will let you talk about Biden's plan specifically, because we're coming up to the last half hour of the show or so, and I want you to be able to use all that research that you've been talking to me about.
I think it's called Soleil. Soleil, there is a non-hormonal birth control pill. I think it's named Soleil. It's very, very rampant in India. This company has petitioned the FDA over a dozen times in 20 years, and the FDA refuses to pick it up. There are medications out there that the FDA says, fuck you, you're not taking. So, yes, Sahili. There are dozens and dozens of medications. Yeah. The FDA says so, and that's another thing. While you guys think of the healthcare system and you think of hospital workers, nurses are employed by private insurers as private healthcare, private caretakers, receptionists, negotiators, plan caseworkers, prescription nurses. We're not talking about jobs that can be filled from going from one hospital to a government system. We're talking about the hundreds of thousands of people that would be laid off that are solely employed by insurance and prescription companies that will not have a place in a government-funded, government-funded system. Hundreds of thousands of them.
Well, and like on this point, again, we're going to finish with the transition in a moment. But on this point, the problem here is that being able to create a bill that large and even understand the scope of what that transition would look like, especially since we do still have the conservatives to be concerned about in terms of trying to get anything passed. You know, the whole point of the stream that's probably going to happen on the 14th with, like, at least Jen and I is going to be that we need to talk about inter-party unity and how trying to compromise across the aisle on something like this is nearly impossible.
Hold on. I'm going to put some clarity because I understand that people that live overseas may not be seeing the full scope. In 2019, the education and health services industry employed the largest number of people in the United States. That year, 35.89 million people were employed in the education and health services industry. 35 million people in this country would either be looking at...
We don't know what percentage that's like doctors, nurses, etc. though.
As a whole. As a whole. So
let's say even 20%.
But let's think about this.
Let's say 20%.
No. Let's take the full 35. Let's take the full 35 million. You have doctors that are employed at private hospitals. You have people that are employed by insurance companies, prescription companies, nurses that are employed by private hospitals. Because I will tell you guys right now, unless you are dealing with a VA or a TRICARE system, the hospital you go to is privately owned. It's privately run by a massive corporation.
And even if we had universal health care, it wouldn't automatically be owned by the government. The government would just be the one negotiating instead of all these insurance companies.
Well, no. And that's... God damn it. Sorry, my camera doesn't want to focus. There we go. And that's the thing. When you talk about a universal option, these hospitals now have to be run by the government. They have to be run by the government. The prescription providers have to be run by the government. The government is not going to pay these people as much as a private company would. They won't. So you have 35 million people in this country that are either looking at a restructure and pay cut or a job loss altogether.
Now, granted, on some ends,
million.
A bunch of that is going to be unnecessary administrative overhead currently because big companies. Mm-hmm. But that doesn't mean that their livelihoods are any less important.
Right. And like I said, you know, people are thinking doctors, nurses, anesthesiologists. They are employed and paid by a private hospital. And each doctor individually bills an insurance company. Or they bill the state aid. And the reason why a lot of doctors won't take state aid is because the state doesn't pay them shit. The state doesn't pay a huge overhead at all. It's the private companies that do.
Now, part of the reason the state doesn't pay shit, though, is because it's not being funded well.
Because it's not being funded correctly. Correct.
Yeah, if we had a universal healthcare option again, it would be able to pay more, but not as much as it's being paid now. It would be somewhere in the middle between the shit pay and the better pay.
Because they would not have the option of having 4, 5, 6, 7 different insurance companies paying them.
But I mean, it would also stop the problem of a $700 bag of $10 saline.
Right. But what I'm saying is that if we were to wake up tomorrow and everything in this country was run by a universal system, 35 million people are looking at job losses and pay cuts. 35 million.
So, Heracles, that's not what we're saying here. We're talking about why an instant snap your fingers bill is not potentially possible or feasible currently. However, this is where we're going to be talking about both Biden's plan and also what Jen and I have been talking about, which is the public-private option with the hope eventually of transition, maybe even a rider of some kind of transition to a single payer. Yes. Because both of us want to end up at single payer at some point.
I am fine with a private rider option. I am fine with that so long as we have caps on how much a prescription needs to cost, how much a prescription can cost, how much now, and how much a doctor can charge, how much a procedure can cost. Yes, if you're going to go through private insurance, it's going to be more expensive. We have to understand there's a business to run. I get that. But there needs to be a cap, a government regulated cap on that. I think there also needs to be a capped regulation on how much they can pay a doctor, how much overhead they can pay a doctor, so that this way it minimizes the public option to just that, an option. Do I think we need universal care? Absolutely. Without a shadow of a doubt. But I think, incredibly just wiping out the private system immediately would do far more fucking harm than good. I think there needs to be a transition base. I think
the only struggle with this, of course, being, and let me play devil's advocate for 30 seconds as the angry anarchist in the room. The only issue with that is that the Republicans, much like with the ACA, are going to do everything in their power to keep gutting it, the same as we're seeing with the NHS.
Can you highlight Aether? Then the cap becomes a price. Not necessarily. Because then you build competition. If somebody realizes that they can get, say, Aetna is setting the price at the cap, and Blue Cross Blue Shield doesn't want people going to Aetna, so they're going to charge less. This is what creates competition in that market. If you have a free option or a very, very, very low cost option, they're going to compete with that to keep business. Because fuck that. Why am I going to say?
Well, and I mean, the ACA actually created even more competition because now they weren't just competing over employers; they were competing over people getting government tax.
People, yeah, like, breaks. And why the fuck am I going to sit here and pay $280 for Adderall when I can get it for $50 on the private the public option system?
Well, and what's funny is my partner's healthcare that he gets it for free, completely with Apple Health. He doesn't have to pay.
Yeah, so Freya, I'm for that. I'm actually for there's a limit to how much medication doctors can prescribe to public patients. That's how we actually have laws on that here for private options. You need a specialized pre-authorization to get more than a 90-day supply of almost every medication out here now. You have to understand that we are dealing with a severely high prescription pain med and opioid crisis in this country. We are dealing with a massive amphetamine problem in this country as well.
Like I have to wait until the last 3 days of my pills in order to pick up my new prescription, and I have to take in a physical. I have to take in a physical prescription at least until COVID. After COVID, they can do electronic prescriptions, but I have to file through an app, and I have to hope that my doctor's around. But even then, if my pharmacy's out, I might be out for a couple days. Even
something as benign as people would think, like blood pressure medication. my mother takes it, and she has to come in once every couple of months to refill her prescription just to make sure that it's still working and it's not overworking.
Medicine checks.
Yeah, same thing with diabetic patients. There needs to be, because if you just keep filling it and filling it, who the fuck is going to go to the doctor? I'm fucking not. If I don't have to, I'm not going to fuck you. I'm not going to go to fucking refill my prescription.
I only have to get my thyroid checked once a year. But for a while, I was getting it checked every 6 months.
But you have to go, you know? I think that a limit to how much medication doctors can prescribe is a good thing, especially in a country where we don't have legalized drugs, and prescription medication is a beautiful street market for more than 90 days.
Well, and you're not even allowed 90-day prescriptions of controlled substances out here. Like, you can only get up to 30 days.
But this is actually in conjunction with a lot of state laws that they have to comply with. A lot of states won't allow it.
Mm-hmm.
That's the big reason why, and I'm actually for that.
My state has the 3-day and 30-day rule.
Mm-hmm. Yeah, I think Tennessee's a little more lax on that. I think Tennessee can go up to 120 that you're allowed to, although they're severely clamping down on that now. But yeah, I think that's a good thing. I think people should go to make sure they're not abusing pain medication. They're not abusing ADHD medication, that their blood pressure medication is working fine. Because what kind of negligence would it be on behalf of the doctor if, say, somebody's taking blood pressure medication, the doctor doesn't follow up on them, the blood pressure medication suddenly stops working and they die? Some public patients only get told that they should over-the-counter pain meds instead of actual care. Of course, there should be a limit for how long a prescription should last. I think that you should...
Any policy is going to lead to adverse outcomes to some degree.
Right, but no, I think you should have enough for your care plan. If your medication is not helping, you need to get in touch with your doctor, especially in the state that I live in. When I see somebody who has a 60-day supply of pain meds and they're gone in 15, we know some shit is up.
Mm-hmm.
So I think personally, I think after Biden watching what his son went through with his cancer, I think it greatly changed his view on public care. I think it really did. He's also got people around him who are screaming at the fact that literally insurance companies are telling heart transplant patients that they recommend they do a fundraiser to cover their cost or a portion of their transplant. I think that Biden is in a lion's den. He's in a pit, and he's surrounded by dragons at this point. However, he does, Biden's old school, and he remembers what economic recessions were like. There were times in the 60s and 70s where we had gas lines, we had bread lines. And I don't think he ever wants this country to get back there again. I know that he is also a president in an extreme time of instability. So I think he really is trying to give an option that, while it doesn't give us exactly what we need right now, it's a step to a transition.
Well, however, and this is a good point from Allison there.
Well, yeah, it does. But you also have to understand, too, that when we live in an economy where, sorry, my boobs fell out, where...
Well, this is an argument in favor of universal health care. If you don't have to pay out of pocket for the doctor's visit, then you're...
Yeah, but to touch on the medicine cap with that, when you have an economy that you have to work 2 and 3 jobs for and you have to work fucking 80 hours a week, that's a lot less fucking incentive to go to a doctor if you can just get the fucking prescription refilled. You know what I mean?
Mm-hmm. So we're coming up on the last 20 minutes or so. Let's talk a little bit about what Biden's plan is, because you did a bunch of research on that, and I'm very, very interested in this, because I've seen a lot of the niggling stuff, and we covered a little bit, actually, when we did the
It's
climate
basically
candidate.
what I said before. He wants to start transitioning over to having options. He wants to start pulling... If I'm not mistaken, I think he wants to fund, for now, he wants to fund more money into the states and have it state-run. He wants the federal grants to the states to be larger instead of just transferring it over to a completely federal system. He's still really murky on this, but this is kind of where his talks have been leading.
So prescription limits should be per patient, not per doctor.
Yes. Yes. I think what he's trying to do is up the funding per states to have the states give each person a public option. Hey, you can come on our system if you want to, but you don't have to, kind of deal. I think that what
We
he's
differ
going
a
to
little bit. We differ a little bit on that. I think auto enrollment should be a thing that everybody should be enrolled onto the public option, like automatically, but have the option to opt out if you really want to. If we're going to do a hybrid system,
yes. I don't know about auto enrollment, but I would say
because without auto enrollment, the southern states are just going to fuck off.
You'd be surprised. You'd really be surprised at how much the southern states actually utilize the Affordable Care Act, the ACA marketplace. You'd really be surprised about that. I'm not sure if I'm for auto enrollment, but I think I'm not for the yearly enrollment. I think once you're enrolled, you should just be enrolled until you say you don't want to be enrolled anymore. Kind of deal. Kind of thing. Auto enrollment would be cool, but I'm not sure how we would track all that.
Well, I mean, auto enrollment would be similarly to the ACA, right? Like auto enrollment, you get into the insurance exchanges, you are automatically enrolled for the public option.
No, you have to call the ACA marketplace to enroll yourself.
Not here.
Every place that I have, every state that I have
not here.
Known about.
We have an online website that you go on and you enroll on whatever plan you're going to.
Well, yeah, you can either call or get online and enroll. Auto enrollment would be if you're on it.
But that's what I'm saying is we have the insurance exchanges that exist already and everybody's social security numbers are already implemented into them. You could set it up so that like right now in my state, you get auto renewed if you don't go in and change it every year. You could have an auto enrollment feature for somebody when they hit when they hit 18,
a lot of states you have
to
if I'm not mistaken, I thought you had to re-enroll every year because we just went through this.
Not here. My partner got a notification from the state that he would get his insurance automatically re-upped if he didn't.
Are they on state insurance or are they on the private?
Apple Health.
They're on what?
Apple Health, which is done through the insurance exchanges. It's the Medicaid
is that a
expansion.
Okay, see that's why. So if you are on Medicaid or a Medicare program, they automatically enroll you, but if you are on a private option, you have to re-enroll every year. If you
his dental and eye care are private, and they were also auto enrolled, same as his regular.
That's pretty cool. Well, yeah. Is it? Paying through the state?
We are paying through the insurance exchanges. So the state pays for his health care,
so
his eye and his vision and dental. We have to.
This is what happened with your case. You got set up with the ACA. And they transferred you over to the state. So now your state is handling it. And that now falls on however your state handles it. But when it comes down to the federal marketplace, if you are under a private insurer, you have to auto-enroll. You have to call to re-enroll every year. Because your state is passing off and handling that within their state. Excuse me, it's different.
But what I'm saying is that since that system already exists, say for my state, if we're talking about nationalizing something like this, you could have a similar system.
What about undocumented people?
Well, this would be tied to Social Security, like numbers. Undocumented people already can't get onto a lot of these programs
but they don't
because
have
they can't
Social Security numbers.
Yeah.
So how do we deal with undocumented people?
Well, that's kind of the struggle with something like this is if you're talking about a public option as opposed to single payer. Like even if I get hurt in England or in certain other countries in Europe, if I'm visiting as an American, I still get free care because it's nationalized. If you're dealing with a public options don't cover non-citizens.
Right.
And so I disagree with that, but this is part of the reason I say we need single payer and not public option.
Yes, and that's where I agree with it. That's why I'm saying with the public option, saying, oh, but have a Social Security number, that doesn't help with undocumented people.
Yes, but it doesn't mean that people with Social Security numbers shouldn't be auto-enrolled. My point. Yeah. We have the system set up where it's possible. It's not that complicated.
I'm always kind of weird about that. I'm always kind of weird about that.
I'm also the sort who thinks that voting should be mandatory, but that's just me.
See, I don't.
My problem is 30% of the population shouldn't decide every election.
I get that, but I think it has to be, and as an adult, it has to be you have to make the choice on whether or not you want to be active and a participant of it. And forcing people to vote with the threat of jail time.
Apparently, Allison has the same thing. When I was on the ACA, I forgot to unenroll, and when I got employer insurance, I had both for a year, and it fucked up my taxes.
Yeah,
so yeah, apparently auto re-enrolling is similar across certain states.
So yeah, certain states. If your state is handling it, then you have to check your state. But if you've gone through the ACA marketplace and got like Humana or Aetna, you got to call every year.
So we've got 2 super chats. Hey, the healthcare thing seems complicated. I miss being a child. MIK, thank you so much. And Hyatt says the current state of American healthcare is a nightmare. We completely agree that is what this stream is about. You are still muted, Jen. You're muted on, like, the streaming end. You muted yourself there, not on your mic.
No, I pulled the cord out on my toe. Like, that was no, Freya, and some, like, I've actually heard people call for, man, if you don't vote, then you need to sit in jail.
Yeah, no, that's not what I'm talking about. I'm talking about, like, Australia's system where you, like, have to pay a small fine if you don't.
No, I don't even think there should be a fine. If you feel like you don't want to participate in your government's politics, I don't want somebody voting for, oh God, Aether, I'm always barefoot. If you don't know and have no interest in how to research a candidate, I don't want you fucking voting.
Stairs in Washington. Everybody gets a voter's pamphlet with
no,
both
that's
sides
great, but you have the choice on whether or not you fucking mail that shit back. You have a fucking choice. Telling somebody, I'm going to force you, literally forcing people to vote under threat of a fine or jail is how you get just straight Democrats or straight Republicans in office, because they don't want to take the fucking time to sit and research a fucking candidate. They don't fucking, people who don't want to get involved don't want to fucking care. So they're just going to vote whatever fucking color they want to vote so that they don't have to pay for it.
Apparently, Diver kind of has a middle ground. Voting registration should be automatic, but voting should not be mandatory.
I am fucking totally for that. I am completely, that I'm cool with that. There's a lot of shit that I'm
hey, Marrow.
Hey, Mara.
So we got $5 dues. I watered my plant. It was brown. It is now green. Just thought you should know something.
We need wholesome content. Right.
Thank you so much, Marrow.
But
Marrow is awesome,
I think this plan, Marrow is, thank you, Marrow. I think this plan is what should have been done 50 years ago. But especially that the state that we're in now, I don't think we have another option. I don't.
Do you mind if I do a quick shill for Marrow? Because Marrow, I just edited a script for her that was excellent.
Sure.
Now, I know you're transitioning out of the atheist community, but I think this is a message you could get behind. Marrow did a video on how not to be a asshole as a brand new atheist, and talked extensively.
It was great.
Yes.
It was great.
I helped edit that script. It was wonderful. It was a lot of fun. We had some pretty extensive and long-running discussions about bits and pieces of it and about different terminology and stuff. But if you guys like Jen or my content, Marrow is an excellent science communicator. You should go check out Nervardia's channel. She's amazing, and she absolutely deserves every one of your views. And I'm technically on her team. I help her out with her scripts every week and have been doing so for almost a year now.
Go sub to Marrow. Nervardia. Find her under Nervardia.
Yeah, you'll find her under Nervardia, but she's awesome, and you guys should definitely check her out.
I don't think Biden has any other choice.
Actually, Nervardia has a good point there.
Compulsory, yes, and I'm fine. No, but even so, you see, Nervardia, we're still gonna have gerrymandering. We still have the Electoral College. So even issuing compulsory voting doesn't stop that. Even turning around and saying you have to vote or you have a fine is not going to stop the RNC from getting polling places closed. All it's going to do is make poor people and minorities have to pay more money or spend time in jail. That's not going to stop that.
Well, this is closer to the way that mandatory voting works in most places. Is you either pick a candidate or abstain, but you have to respond.
I'm cool with that. That's what
compulsory voting looks like. There's usually a not applicable type option on a lot of those ballots.
I did that.
You have to
I
send
did
them
the
in.
no choice option. But I don't like making people feel that they have to be forced to do something. Like I said, unless it's a threat to public safety, like vaccines, then no, fuck you. If you,
we should do a stream on that too about why vaccines need to be mandatory.
yeah, as long as your choice does not hurt somebody else, I don't think you should. Like, I feel when it comes down to the public option, I think that every child should be enrolled, regardless of what their parents think. However, I don't think that the parents need to be enrolled.
I think that people should be auto-enrolled and should have the option to, like, kick themselves off. And it's possible to be auto-enrolled. And if we're all paying our taxes into the public option regardless, like, you can opt out if you have, like, insurance that you really like through your company or whatever. But, like, everybody with a social security number should be auto-enrolled at the age of 18 and have the ability to opt out if they really want to.
Duver, here's my thing. I'm not going to force you to put something in your body. I'm not going to force you to carry around something you don't want to. However, I can turn around and say that you're not allowed in schools, public places, playgrounds. And I think every private business has the right to say if you're not vaccinated, then don't come in.
The only way we'd be able to, we need to talk about that on a future show. We've discussed that because we had that conversation for like 4 hours one night because we both got like mad in general, just randomly, and decided to talk about it.
So
y'all don't even understand what happens on our WhatsApp at night. Like Jen and I have the conversations on these shows like days ahead of time, and then just decide to do them
to just talk about it here.
Socialist Dragon. We need to do a better job on teaching to be a conscious voter. Also, maybe implementing an electoral bill of rights.
Okay, Socialist. How are you going to fund each state to cover that when we're already covering programs? We're already cutting programs. I'm sorry. What's the plan for that? I'm all for the education of being a conscious voter. However, a lot of kids can't even get a music class right now.
This would happen in Minecraft, but I'm all for it.
I'd Nerf gun that bitch.
All right, so we are in the last 15 minutes. We're technically at the shill portion. Do you want to wrap up talking a little bit more about Biden's plan or your opinion or anything else?
I think Biden understands, especially after watching his son die of cancer, the importance of everyone having insurance. I think he also understands that he can't afford the layoffs. And he can't afford to divide the country even further. I think he knows this is his only option. I think he needs to push further for prescription cost caps, for doctor payout caps. I think there needs to be some tort reform done. Not, like I said, not the Rand Paul, fuck it, we can't sue anybody kind of shit, but there needs to be some tort reform done. I think he needs to start putting pressure on private insurance companies if he wants to allow a private option. But I think he knows. I think this is absolutely the first step. And I think if we can figure out this experiment and see how it runs, I think this would be the ultimate proponent. This would be the ultimate boost for a complete system.
Well, I also think that at the very least, having it, again, some kind of auto-enrollment for the public option, like we can't give the states the option to take it or not because of what happened with the Medicaid expansion.
MIK, don't bring that shit here.
Yeah, we don't talk about
it. Ain't for here. Yeah, this ain't here. Nobody wants to hear that shit. That shit is almost 2 years old at this point. Don't bring that bullshit here.
It's actually a year old because it's about the time that I came into the community. That was going on.
It happened
last year in like August or September.
May of 2019.
Yep. I came into the community around July. So like, yeah, it's about a year.
May of 2019. It's been almost 2 years.
But yeah, my point being though, one of the rules on the coalition, formerly the Bridge, is we don't talk about drama. Like we talk about policy, we talk about ideas, we don't do drama.
This shit happened in May of 2019. Leave it there. Okay.
It one warning. That's all we need. Mm-hmm. They're usually pretty good about stuff like comments and everything. So, But on my end, I think that this could be a very good transition, especially if we do have some form of auto enrollment, especially if we do give people a taste of what it's like to
Mm-hmm.
get, the ACA Medicaid expansion did massive things for poor people, but people that are kind of in the in between, people who made like $30,000-$40,000 a year, didn't have good insurance through their
Yeah.
job, but also couldn't get onto decent state health
And
care. They kind of got left through the cracks, and a lot of those people got angry. And I think that something like
and
this
I
is a
think
good way to bridge that.
I think Americans are not going to realize that it doesn't cost $700 for a Tylenol until it actually happens. I think that's the biggest hurdle with Americans is they see our current system and they see what our current system is costing, and that's why they're like, how are we going to afford this? Because
But the thing is that bag of saline only costs $10, and it only needs to be 10 to 20, 10 to
yeah,
20 for.
not 200. I think that's the biggest roadblock we have is that Americans are judging how we're going to pay for this on the prices that we're paying now with private insurance and what private. And you guys also have to remember that it's not just the insurance companies that are charging this shit. When you see a $200 bag of saline or $500 ibuprofen, that's the price set by the hospital, not by the insurance company.
And the hospital, generally, there's an entire thing that goes on behind the scenes between the hospital and the insurance where the hospital sets that, then they haggle with the insurance to see how high they can get it so that $2 pill, like let's say it's
So
a
that
$2 highly
yeah.
concentrated ibuprofen pill, that's way higher than what they paid for.
Yeah,
but let's pretend that it is. It's going to cost you $70 through insurance or $200 through without it, because the $200 is the starting price, and
right.
they're
Everyone
basically
always goes
sitting
after
down.
the insurance companies. No, who y'all need to be going after is the fucking hospitals, because it's the hospitals setting the price. And then they have to negotiate with the insurance company about how much the insurance company is going to pay so that the hospital turns a profit. Hold on. The largest.
And the pharmaceutical companies are right up there too. Again, that $250 like per 30-day supply for Adderall that I was citing, that was near universal across pharmacies, which means that that's something going on with the pharmaceutical company itself.
So I live literally the hospital. One of the hospitals that I go to is owned by the largest health system in America. It's HCA Healthcare. They own over 200 hospitals in this country. There are companies that, the Cleveland Clinic, over 1,300 beds. Barnes Jewish Hospital. The people that you need to be looking at. Right. Well, Katie, I'm not talking about the medication right now. I'm talking about the care, not the prescription. So here's
the
thing.
example we gave was a prescription pill, so that's why I got confused.
But that's the thing. So the hospital buys this pill from Motrin for $5, right? The hospital then charges. So say that the pill costs $1.50 to make. Motrin will charge the hospital $5 to buy it. The hospital then sets their price to charge the insurance company. So while
20 pills of prescription 400 milligram ibuprofen would run me about $30.
Yeah, about that. So this is where it comes down to. Yes, we do need to look at the manufacturing companies, but where the insurance companies are getting their prices from is what the pharmaceutical companies and the hospitals are charging for care that they have to negotiate. Yeah. Yeah, it might show up in a solid gold. Yeah, it's... What would the Cadillac of healthcare be? And this is what we're going to base our prices on.
Neither. Technically, the suits
Both.
work with an entire. Technically,
Both.
it depends on the hospital, because
It's all
the suits tend to
accounting.
work with an entire accounting department that
It's all
determines
accounting
it.
socialist. So say Pfizer. No, not Pfizer. Somebody makes a vaccine for 2 cents and then sells it to Pfizer for $5. Or an injectable, say Toradol. I used to have to get Toradol injections all the time, so we'll go with Toradol. We'll say it takes $5 to make this Toradol injection. The people that make it are now going to sell it to the brand company, say Pfizer. It costs $5 to make, they're going to sell it for $10. Then Pfizer sells it to the hospital for $25. Then the hospital has to say, okay, what can we charge the insurance company to cover? And then they shoot it up to $100. So where we really have to look, the biggest jump that we're seeing in costs when it comes to medications is between the prescription drug companies and the suppliers. These are the two that are holding the biggest ones. It's not the insurance companies but the insurance companies are a good scapegoat. It's not the insurance companies that are setting these prices. They are, but they're setting the prices because they have a business to run too. They have to stay afloat too. The two places that we need to be looking at are the prescription drug companies that are setting the prices for the drugs and the hospitals that are setting the prices for the care. Because if the hospitals set a fucking lower standard, then the insurance companies have less to cover. If the prescription drug companies set a lower price, then the insurance companies have less to cover and therefore are going to charge the consumer less. This is where y'all need to be looking. Y'all need to be calling on these fucking gigantic hospital corporations and saying, why the fuck are your prices like this? If we're going to have a true universal system, we cannot have any kind of privatized healthcare. We cannot have privately run hospitals. We cannot have privately run prescription companies because that is where your markup is coming from. That's
well, and granted, there is a strong argument that a single payer system can deal with that fairly effectively in that they're now negotiating with one insurer instead of a bunch of private insurers.
Then what are you going to do? Say Pfizer charges the hospital $10 for that Toradol shot. You have one payer.
So that payer is going to end up setting the price.
No. It's healthcare.
That's the way that it's ended up in several other countries. No, like the government sets it or the hospital goes out of business.
But they know the hospital knows they're not going to say no. The hospital knows, well, we have no other choice because we told people we'd cover their care. So the hospital just gets to set it because they know they have to pay for it. This is why diabetes medication is so fucking expensive. Because they know people aren't going to say no. They know that they have to buy it. They know that they have to cover it. It's the same fucking concept. It's not so much the insurance companies that we need to turn an eye to. It's the private fucking businesses that run the healthcare agency, the hospitals, the pharmaceutical companies, the drug manufacturers. This is who we need to turn our eyes to. They only charge that much because they know that they can, because they know companies have no other choice but to accept it. Especially when you live in a place like I do, or if you live in a more rural area where the closest hospital, you have a local hospital and the next closest one is 3 hours away. They know they have to cover it because then people in that area can't get care.
Well, and this is why people with chronic conditions like me have to live in city areas. I would love to go live out in bumfuck nowhere, but there's no gastroenterology specialist out in bumfuck nowhere that can make sure that my celiac is taken care of.
Yeah. Here we have one hospital here. That isn't great. It's not great. But your only other option is to drive an hour and a half to another one. Yes, sir.
Hello, that's baby dragons. So that's a good place to transition to the shill portion. So in conclusion, Jen and I both want single payer, but it's going to take a long time to get there. And
it's going to take a full transition of government running hospitals. That's the big key.
And it's going to take it, and people are going to have to warm up to the idea by getting used to having a public option first, because that's the way this country is.
And we're going to have to find a way to transition 35 million jobs. 35 million.
So, Jen, what have you got coming up?
This week, I will be releasing a video on how to deal with toxic family members. The holidays are coming up. And, we hear a lot of, but they're family. And that's just the way that they are. We all, we've all heard that. And
I wonder how many conversations we've had on this topic as of late.
For both of our families, right?
Jenna's literally my lifeline for a certain toxic family member.
You hear that when it comes to personal boundaries, but you hear it a lot when people kind of meet up and, they bring their kids around and it's like, I have these rules for my kids, but they're going to do what they do. And I don't want to speak against them because they're family and it was the blah, 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 blah. So I'm going to be doing an episode on how to deal with that Friday, I will be having James O'Neill on, who has a long-standing
an interview on a Friday again. It feels like it's been a year.
No, it's been 2 weeks.
Hey, that's eternity in
Assassin's
YouTube time.
Creed makes it feel like it's been
a year. So does Hades. Like, one of my friends bought me Hades, and I have not been able to stop playing it.
Friday, I will be talking to James O'Neill about election reform. So, kind of good to lead into what we were talking about.
Gonna go very informative. Gonna go watch the Heracles video now. Akeda is one of my patrons, by the way, so Akeda currently has access to it because, like I said, I rushed through and got it done today. So patrons, if you guys are hanging out in the chat, and I know a number of you are, go check out the Patreon portion or log into Patreon, and you can check out the Heracles video. So on my end, that actually is what I'm releasing this week. On Thursday, I'm going to be releasing a Disney's Hercules versus Greek Heracles. How accurate was the myth? I'm warning you, I go on to a whole frickin' rant because they took one of the most wholesome, happy ending myths, one of the very few, which anybody who's ever studied like Greek mythology knows just how depressing it is. Like, they took one of the few stories in Greek mythology that has a happy freaking ending and turned it into a cautionary tale about fucking cheating. So you get a whole rant from me in the middle of the video about that.
My kid's not into Disney. Like, he's not a Disney kid at all. He's a Nick kid, but he's not to Disney. So
well, I went through the whole movie and like took notes on everything and then went and found all the myths that all those stories were related to. And by the way, I didn't use any of those compilation articles that people have written already. I did my own digging into all of the different versions of the Heracles myth that are currently published and translated.
How they turned Pocahontas into a love story?
Oh gods, we are going to do a stream about that one of these days, like just the two of us, and I'm gonna rant my fucking face off because as a Native American, I got feels about that shit.
With you as a Native and the fucking way I go hard against fucking abusive relationships, that's gonna be a good one.
Oh my gosh, I'm gonna get so like I've got feels about. I got opinions, guys. Like y'all know what happens. I've got opinions. I got thoughts on this.
I got thoughts.
I will be angrily Native American in a British accent, and it will be glorious.
I got thoughts.
But yeah, so as far as like the myth, I talk about that. I talk about some of the very weird decisions that they make. Like there are some details they included that I don't understand why they included, and there are some things they got wrong that I don't understand why they got them wrong, and choices that they made that I don't get at all, and an entire plot line that they just made up for no reason whatsoever. Because like the Heracles myth, it's rated X at best, but like I mentioned at one point that he sleeps with 50 women to produce a god offspring just because he can, and that's before he gets married to his first wife. Like that's how crazy the Heracles myth is. Again, you don't want to miss this video on Thursday, Jen. It's a trip.
Okay.
Like I had some fun with friends. This did not make it into the video because I didn't want to get demonetized that early, but I had some fun with friends figuring out what the world records for certain adult themed things were to figure out if that would be possible in a day, because he's supposed to go off and sack a city the next day.
Ooh.
So like we went and figured that out. That's actually in the adult section of the Discord if you want to go see all of our fun with that.
Yeah, I'm on a social media burnout thing right now.
Well, I'll send you. I'll DM
send me the
screenshots
because like that's why you guys really haven't been seeing me on Twitter and shiz, because like when you just like I can't do this right now.
I know you're here for this though.
Yeah, like, but when you're like, you know what, I just can't deal with this. And yeah.
So for those of you who wanted to see the Stoicism wine rant, I done fucked myself up on Thanksgiving, and again, Jen got to hear about it, and so did everybody on Discord. I was dumb and decided to start a physical therapy type routine the day before Thanksgiving, and then cook for 6 hours the next day when I had delayed onset muscle soreness, because I'm fucking special. And then the next day, I thought I was better, because like I was like, okay, I'm gonna rest the entire day. Next day I thought I was better, went on a walk, and completely hurt the hell out of myself a second time. So that's why Saturday didn't happen. Callan has stuff going on next week, so we've rescheduled it for 2 weeks out, not Saturday. And then Monday, Jen and I are going to be talking about specifically how to handle the holidays when you have differing belief structures. So like Jen is going to be talking about that from a non-religious point of view. I'm going to be talking about it from a pagan point of view. We're going to be taking Q&A from the chat. It's going to be a much more laid back stream, but we're going to be talking about that kind of as partially a follow-up to our Toxic Family video, because there's some unique challenges that come from differing belief structures. Even if you're just two different denominations of the same faith, you got a Catholic and a Protestant that are meeting up, and there's going to be like hands thrown eventually. So we're going to be talking a little bit about that.
Yeah, like I was dating an Episcopalian, and my Catholic family fucking lost their mind. They were like, I'm like, I'm a whore. Like, I'm not really a Catholic. I'm just a whore that shows up for funerals and baptisms. Like, why is this shocking? Why? Anyway.
So that's what's coming up on my channel. We went a little bit over an hour and a half, but we were actually pretty good. We stayed on topic most of the stream. I'm proud of us, Jen.
Yay! We did it.
So thank you guys so much for all of your support. Thank you guys for hanging with us.
Yeah,
it's getting close to the holiday season, and I know y'all are all getting busy and your time is limited, and everybody's streaming right now.
Right over there. I fucking lost my mind with the fucking Black Friday sales that were online. There's a whole gift station with just boxes and shit right here. So I was like, fuck, I need wrapping paper, right? So I ordered 4 of the 3-packs from Walmart. They didn't have one, and 2. They didn't have 2, and then substituted it with 2 more. So now I have 6 packs of 3 packs of wrapping paper. I can literally wrap every one of my kids' gifts in a different paper at this point.
All right, so thank you guys again so much for hanging with us. Like I said, everybody's streaming, everybody's busy. Y'all are here, and we appreciate you. Thank you all for the people who did super chats. Thank you guys for your amazing questions. And remember, we built the coalition. Now we fight. We're stronger together.